Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. Thanks for joining us today, where our guest today will be Tawan Stoker, Director of Wellness for Reid Health. Welcome, Tawan.
Hi, Sherry. Thank you for having me.
And we're excited that you're going to focus on men's health. That's something often overlooked.
Yeah, very true.
I also neglected to say, Tawan, tell us a little what you do at Reid Health. You've been on Reid Beside You before, but let us know what you do at Reid Health.
Okay. Well, I've been at Reid for about 11 years now. Multiple things, multiple departments that I manage and direct. Newer department, medical fitness, just falls up under wellness services, along with massage therapy. Our health coaches, wellness specialists, you name it. We have a whole gamut of programs, along with HealthWorks, which is also in Connersville.
Okay.
Yeah.
So not only are you helping with the community being well, but also Reid employees.
Yeah, we have Reid employees as well. So a lot of times what we do, we start a lot of our programs out internally with the employees first, and then we kind of see how they go, and then we'll move them out to the public in hopes that those programs will, develop the same results that we have internally. Our goal is, of course, to continue to make the community, a higher place of well-being overall.
Well, great. So when we look at men's health, that is often overlooked but really needed, tell us about some of the men's health statistics.
Okay. Well, I hate to say this, being a man myself, of course. One of the things that we fail at as men is, we don't go to see the doctor on a normal basis, and so the numbers are very, very low when we look at men going to see the physicians in comparison to women. Not that we're trying to compete with women, but we also should have the same benefits and realize the same benefits as all groups do. So when we look at statistics overall, men themselves actually die 5 years younger most of the time than women do when it comes to health overall. And that's disheartening for a lot of males and a lot of females and everybody that looks at the whole stat.
Right.
But the CDC has different ways that they're looking at this information and trying to put in initiatives to help influence men overall.
So these three leading causes,
Yeah.
tell us about those.
So you got heart disease, which is number one killer for men overall. So with heart disease, we know that there are a number of things that can affect an individual's heart when it comes to diet, lack of physical activity, and so on. So our goal is to try to encourage men to be better at these things, to realize that, by doing some of the most simple things, by spending a little time to be healthy and start thinking about their health overall, that they can be healthy overall and also extend their life. Second one being cancer. Cancer affects everybody. Most of us have a loved one or a friend or a family member who has been affected by cancer in some way. But with men, it's also one of the ones that's taken us down quite a bit. And then you look at unintentional injuries also.
Now, this is always interesting.
Yeah, so unintentional.
So share with us.
Unintentional injuries, that ranges from a number of different things, from accidents to accidents on the job, to just not paying attention to things and paying attention to rules.
We've also, a lot of times on social media or different things, they'll have that men take more risk.
Yeah.
So they don't need that person spotting them on the ladder. They can do it themselves.
Right.
So.
Right. Yeah, I would say that contributes to it a bit, but also that expands across all different genders as well. So just not men taking those risks, but in this category, as we're speaking about it, yes, that does pertain to that. Yeah.
So how can we, for men to stay at the top of their game? What's some things they can do?
A couple of things. I mentioned a few of them just a second ago, but a couple of additional things that men can do. First, healthier food choices. We got to start including fruits and vegetables in our diet. And I'm not putting together or saying a certain number or a certain amount. just start by adding something to it, adding fruits and vegetables.
Okay.
Secondarily, exercise. I'm not talking about going and trying to lift the whole world and lift everything, so because it's not just
Everyone's
about
not
lifting.
as watches it like you do.
Right. Well, I would say hopefully we can get everybody to that point where we're starting to look at it and pay attention to it that way and watch it on a daily basis. But any level of exercise, 30 minutes of physical activity throughout the day, 15 minutes one time period, 15 minutes another time period will definitely help out individuals. In addition to that, the most important piece, I would say, most important tip would be to get a doctor. Start building a relationship with the physician. There's too many men that do not have a physician. They don't have a relationship with them, so they don't know the health history, that goes on throughout their whole lifespan that happened beyond, before them.
Do you find that that men often wait until there is a necessity they might have had a heart attack or some type of scare before that they would get on a rotation to visit a doctor?
Yeah, I would agree. And at time periods, it's the extreme situation where they may have had a heart attack or something that was pretty severe, or down to something that may be considered as less severe. They may have go through a health fair or a health setting and get their blood pressure checked and notice that it's very high. And they may also drive them to visit their physician or get a physician. So don't wait until that time period to those numbers come out. Go ahead and get a physician now, so that way you can start building the base with the physician.
We did a community event where we were in barbershops and did blood pressures.
Yeah.
And it was pretty frightening
Yeah.
to see, especially we found men mid to early 40s who hadn't had a checkup since they played sports in high school.
Yeah, and that's normal too. We're starting to see things swing a different way now. As more education comes out about having a physician and needing a physician and building that relationship, we're starting to see individuals now have physicians on a more normal basis now. Yeah.
And that's great.
Yeah, it is. And tobacco use. I don't have anything great or good to say about tobacco use. You just cut it out now as much as we can. Start working on plans to kick the habit. Again, start having those conversations with the physician about plans to kicking the habit too. And that'll definitely help individuals in the end.
A question, we've also seen a lot of people who have now moved to vaping.
Yeah. Equally as dangerous, if not more. We've seen where vaping not only harms the individual that's using the products, but it also harms children that may be in the proximity as well. So if you're not thinking about yourself, consider yourself, of course, but also think about your family members and the children that surround you. And but last one I kind of want to hit on is something that that men have somewhat ran away from for the longest, is the mental well-being piece. So mental health, that's something that's very, very important to all, to everyone, I would say. But men, we've kind of said to ourselves that we can handle most of the situations on a normal basis, and not giving the mental health experts the credit that they deserve by going to meet with them to help us through those tough situations that we're facing on a day-to-day basis. Yeah.
And so what are some other things that along with the mental health, what would you recommend? Or family members to coax the men in their lives to visit for mental health without having a screaming match?
Right, true. Well, I think it's just basically sitting down, having a conversation. Of course, both parties have to be open to it. If you're going to sit down and have a conversation with someone, that individual has to be open to it as well. Screaming and yelling, of course, all that's going to do is add to the stress and the pressure. An individual will probably turn the other way and not want to be a part of anything. So basically having that conversation there. But again, I'll go back to having a physician. That physician will also help guide the individual to the correct practice or to the correct individuals that's going to help them out along the way. So the physician has a way of actually having that conversation also. I've seen children also have conversation with their parents. Kids are learning so much in school and learning so much from different programs now that they've encouraged their parents to also, or caregiver, whoever adult that's in their life, to also seek help.
We've seen that children really seem to be a very good, I know that in other events we've had the dirty lung, and the children have literally brought that to their parents' attention. It's, you don't need to do that.
Right.
So.
Yeah. Especially, and you're definitely talking about the pig lungs. You
Right.
have the black one, and then you have the one that's clear in how it's supposed to look. And children see that, and it's one, it kind of grosses them out. But two, it gives them the opportunity to be able to go back to their parents and have a conversation with them about what they saw, and then hopefully the parent or the caregiver has the opportunity to reinforce that, yes, tobacco use is not good for you.
Right. Yeah. And Tawana, before we wrap up, what's like the main, we've gone over these 5 points, but what would just be the overall thing that you would want men to know?
Well, I think we all have goals that we're trying to achieve, right? And at time periods, we feel like we're invincible and we can get to that goal without any kind of assistance or help along the way. But we all need some type of help. We all need some type of assistance. And I'm speaking to it right now from the health and well-being standpoint. And I feel like men, that it's okay for us to reach out for help. It's okay for us to have conversations with medical experts about what are the next steps for them to become even healthier. If you feel like you're at a healthy stage right now, and if you don't have a physician, go ahead and get that physician. So those are the steps I would say, they need to take to continue to progress in a well way.
Well, great. Well, Tawana, I want to thank you for joining us today on Reid Beside You.
Thank you.
And please stay with us as we join our new guest, and we will discuss aphasia.
We know this legendary institution. They have 3 goals: pain-free, quicker recovery, and shorter hospital stays. Here are your doctors of Reid Orthopedics. When your shoulder is out of whack, there's one doctor who's got your back. Fresh off the farm from Indiana, the eviscerator of pain, Dr. Chris Nair. No joint too stiff to flex, no bone too complex to fix. Hailing from the Great White North, Dr. James Bones Natal. From Wall Street to Well Street, he hung up his tie for scrubs, replacing hips that give dividends for years to come. The Wizard of Well Street, Dr. Mario Lee. Piloting the Mako robot, he'll eliminate your knee pain with the laser-guided focus of an F-16, getting you back into action. The talent, Dr. Joel McClurg. Over 500 Mako robotic surgeries, 0% index complications, with comprehensive bone and joint care. This team, this care, this treatment. The doctors of Reid Orthopedics.
Hi, I'm Sherry Harlan Davis, program host for Reid Beside You, and joining us will be Jenny Viltari she's the Director of Rehab Services, and Carrie Park, also from Reid Rehab Services. Welcome, ladies.
Hi, Sherry.
We'll start with you, Jenny. How did you come to Reid?
So I'm actually a resident of Ohio. I commute every day to Reid. I've been here just over 3 months, and I've been loving it so far. I love the family community feel of Reid.
Well, great. And Carrie?
I graduated from Ball State with my master's in 2014. I've been working for about 8 years, 5 of which have been at Reid as a speech-language pathologist at our outpatient rehab services.
Well, thanks for joining us today. And our topic is aphasia, and that is something that's been in the news recently. People probably hadn't paid attention as much to the topic of aphasia, but with the notice of Bruce Willis being diagnosed with aphasia. So what is aphasia?
So aphasia itself is a language disorder. It is not a disease in itself, but a disorder that is acquired by some other process. And typically with aphasia, it causes problems with understanding, speaking. It may affect your reading or your writing. The primary cause of aphasia is a stroke. And an important thing to note is that people with aphasia maintain their intelligence. They maintain who they are as a person, even though they may not be able to communicate the way they used to.
Okay. And how is aphasia primarily acquired?
So aphasia, as I had mentioned, the primary way to acquire aphasia is through a stroke. But there are other causes which may include head trauma. So if you're in an accident, you have a traumatic brain injury, a brain tumor, brain infections, pretty much any other neurological causes may have a person acquire aphasia. But an important thing to note is that aphasia can affect anyone, any age. You might have someone who's relatively young that might have a TBI that might acquire aphasia. All genders, all races, anyone may acquire aphasia.
Then what's a common characteristic for aphasia?
So common characteristics can vary by type of aphasia. So someone might have trouble speaking or writing. They might have difficulty thinking of the words they want to say. They might only be able to speak in short, very short utterances, so 1 or 2 words at a time. They have trouble formulating sentences. They'll have, when you're talking about writing, they'll have difficulty spelling words. They might also confuse word meanings, so they might say yes when they mean no, or they might say a word that's similar to the word they're looking for, but not quite what they want. So these characteristics are typical of what we call Broca's aphasia. So if we're talking about a different type of aphasia and common characteristics, there's Wernicke's aphasia. And in this type of aphasia, the common characteristics you'll see is they have more difficulty with understanding what is being said to them. So, or if they're reading as well. So they might be able to follow simple commands. They might need you to repeat things multiple times. They'll have difficulty. They'll get lost in a conversation. Visual cues can help them to understand. And again, they might have difficulty reading the print or writing, and they speak words a lot of times that don't make sense. But to them, they think they're saying the word that they want, which can be a big stressor and frustration for families, just because the person with aphasia thinks they're saying what they think they're saying, and on the other end, you're like, that's not a word.
Should you recommend patience? Patience, that a person should have patience when...
Absolutely. Absolutely. The family members, friends, caregivers of a person with aphasia, patience is definitely one of the things that you will learn to have if you do not have it already. But when we get to talking about treatment options, your speech language pathologist will absolutely teach you strategies for communication and how you can best set your loved one up for success with communication as they're going through the rehabilitation process.
And then we have the different types. So a primary progressive aphasia.
So this is a less common type of aphasia. You don't see it very much. I've seen a few cases as I've worked with patients. This is a little bit different from a regular aphasia because, as in the name, it's progressive. This aphasia is going to get worse over time. It often kind of goes together with a dementia or an other progressive neurological condition. And unlike with typical aphasia, therapy isn't going to reverse aphasia. If someone has a stroke, sometimes they can get back to who they were before the stroke and their communication abilities. This one is not the case. It's just going to kind of progress. So what the therapist would do is help maximize their ability to participate in communication and give strategies to their family and loved ones so that they can have as great a quality of life as possible.
And a person with aphasia also can have
so there are several
things.
Yes, there are several things, and a lot of times they get confused, I think, especially if you are new to the process. One of the big things that you can get from a stroke especially is dysarthria. That's the slurred speech. This is a lot of times what people have when they first have the stroke and you can't understand them. Their speech is very unclear. That gets mixed up with aphasia a lot. There's also apraxia, which is more of a motor planning issue. So somebody says, this is the sound that I want to make, and their brain to their structures, it doesn't come out right. It comes out as a different sound, or they really just struggle to get the sound out in general, so they kind of grope for it with their mouth and they just don't make it. There's also going to be physical difficulties possibly. If you can't use one side of your body because there's too much weakness, you also can't probably write if that is your dominant side. And a lot of things I think people forget to think about is the social issues that people will have. So if you can't communicate, it's going to keep you from being able to be effective at work. It's going to keep you from being able to express yourself clearly with loved ones and in relationships. You can't participate as well in social events. Jenny mentioned conversations, you might get lost, and that's very frustrating. A lot of our patients end up with some mental health issues and depression because we like to talk, and if we can't, then that's just very sad to be around others and not be able to participate.
And to feel included. So it's interesting because I've had 2 strokes, and so when you're saying let's talk about the speech therapy. I know you might never think of it now because I talk all the time, but it was really hard at the very beginning because I had to do a lot of things with the speech therapist. So I understand that process.
Yep.
So tell us about the therapy intervention.
So what the first step would be is that the speech therapist is going to do an evaluation. We're going to look at expressive language, just being able to verbalize. We're going to look at comprehension, what they can understand, and possibly reading and writing if it's reported that they're having trouble with those things. What we do, it kind of varies by the person's ability, but most of the time during our weekly sessions, possibly more than that depending on the severity level, we will do structured tasks where we might have them work on naming, describing pictures. A lot of patients, I try to have them work on saying family member names or important words to them so that they can communicate a little bit easier. I provide a lot of education and counseling to the family members and the patients so that they can assist and communicate effectively outside of a therapy session. And then we might also identify if they might need a speech generating device or AAC device in case natural communication is not going to be effective in the future. That's a way that they can express themselves.
And approximately how long are the therapy sessions? It depends on how.
So here at Reid, we do typically a 45-minute session, but if someone has very little deficits, it might only be once a week. Sometimes we can go 2-3 times a week in an outpatient setting. It's not an everyday thing, but I do send a lot of things home for families to work on with the patient so that they can practice. Communication's not a once or twice a week thing.
So you're getting homework.
Yes. Yes. Some of my patients love it, and they have family members that, like even grandkids that they might do it with, which is kind of nice to include that. It helps to motivate.
And recovery, how's that work?
So as a person's brain is going to heal, they might have less deficits as they move forward. We're looking at mostly that 6-month time period after the injury is when the most recovery is going to happen. Sometimes there's some spontaneous recovery. Usually after about a year, that recovery does slow down. I have had patients that have felt like they got back to normal. Some people will still have deficits, for the rest of their life. We just try to maximize their ability and that recovery. Like I said, it does vary from person to person, but I think the important thing is to make sure that if someone does feel like they're having any of the deficits we named, even if they don't have that diagnosis, to reach out to a physician and say, here's my trouble. They can always come to a speech therapist and we can evaluate and see what we can do to help them.
And when communicating with the patient as well as with families, what's some of the tips that you would recommend?
Yes, we did talk about patience, understanding that it's going to take some time and that patient needs that extra time. I talk to my patients a lot about self-advocating, making sure that they tell people what they need, even if that's just a hand up to give them a second or they can verbalize it, making sure that you don't try to finish their sentences necessarily. I often say it's better to ask the patient, is that okay? Respect their wishes, they know best for themselves. Make sure that you're talking slowly, making sure that they have time to understand and process what you're saying. You might need to repeat yourself or reword or rephrase what you're telling them to make it a little bit simpler or easier. If that person's having trouble communicating, see if they can gesture, see if they can write or draw. I've had a couple people that were artists, so that worked for them.
Okay.
I could maybe do stick figures. But I think the important thing, we know we've talked about it, don't talk down to them. They still know what's going on, and they still want to be engaged. Don't ignore them in a group conversation, include them as much as you can.
And like I said, the patience thing really is
It can be challenging, especially initially.
definitely. And another thing that I saw in the communication is crowds. So do you gently bring people into a crowd or just to see where they're at?
I think crowds, it depends on what they're having trouble with. If someone has more trouble with understanding, obviously all that background noise is going to be more of a distraction and is going to make it harder. Seeing if you can, with the masks we've had for COVID, that's been really great for speech therapy, but sometimes being able to have a visual support, so making sure they can see that and they're not distracted by other things. But yeah, it's better probably to stick to smaller groups, especially at first, and then kind of feel it out as they're comfortable.
Okay. Well, this has been very enlightening. And we have learned a lot, and it's always interesting to talk about things that we've seen in the news. And we want to thank you, both Jenny and Kara, for joining us today on Reid Beside You. Thank you very much.
Thank you.
And thank you for joining us today on Reid Beside You, and we'll see you next month.